distraction for Jennifer here. Now, because she's experiencing a little bit of pain in her left side, we're not only going to have the table flex, but I'm also going to have it laterally flex as well. How does it feel over here?
Good.
Okay, can I go a little bit more? Alright, she's pretty up there. Cold cream here, okay? Here we go, 1, 2, 3. So you say you're doing a lot of driving? Let's see that. Wherever you, yeah, you can sit over there. Where are we at today?
That's the same.
Keep it a 4?
Yeah, it's still pretty tight.
Your mid back was a 1.
Yeah, it's still fine.
Still a 1, and then low back was a 2. 3 maybe? A little stiff?
No, my low back is
Low
fine.
back is
It's
good?
just my neck. I feel like every time I come, like by the time that the month rolls around, like my neck
You
just
start
feels
to
like
feel it,
it's-
right? Fortunately for all my patients, they get better quality care here versus another chiro.
Yeah.
Face down. Serena here also finished corrective care number 1. She's been on her monthly plan, which is great, so we're happy. A little bit off. So we're gonna work on glutes, hamstring, upper back, mid back, and then kind of flip the other side too. Ready? 3, 2, 1. So what this is good for is number 1, to improve circulation and blood flow to the muscles. The second thing which is good for is it helps get rid of any lactic acid. Are you foam rolling still or no?
Not enough.
Okay. How about posture bump?
Not enough.
Okay, I wonder why your neck hurts. And let it out. Good. Perfect. Lay on your side facing me this way. There you go. A little small one. Ocular migraine. When that does happen, sometimes the muscle over here is to blame. But that's also if you were like in a car accident like a long time ago and you kind of just had a lot of like built up tension there. So I do like a little release of the sternocleidomastoid muscle, SEM. And once I do that, you'll feel it like in your eyebrow, like in your eye.
Ooh.
So that's another one that we can do. So let's see here. Drop it to me. Think of a number between 1 and 3. 2. And then last one. Bring your left foot out a little bit for me.
Oh,
There we go. That was crunchy.
that was very crunchy. I knew I needed that.
A little looser.
Yes.
Done. That's all I have from here. So hey Jeff.
Hello.
How's it going?
Good, how are you?
He came to me, was in a ton of pain with his neck, his right shoulder. He's been doing great, and you know, hear him firsthand to see what he's been through.
A lot of shoulder pain,
Okay.
mid back, lower back, and just through all the different therapies, everything seemed to dissipate. And we checked on one thing with my hips being uneven, and there was one little adjustment you did that fixed me right away.
So I'm very happy. Let's start you off over here. Is it all 3s all around today? Or you think a little bit better?
A little bit better, like I did some physical therapy.
Good. Come back down. How's that pressure?
Good.
Good. And again. Good. Last one. Good. So now you can see his scapula is kind of popping up a little bit, and this is where I have better control of his shoulder, and we can kind of dig in and really get into here. A lot of times the rotator cuff, the rotator cuff muscles get super tight, and then what ends up happening is there's a lot of overcompensation. So what I'm trying to do is I'm trying to decompress those areas so that the other muscles can pick up the slack again and have the shoulder operate fine. Some people go fast, some people go slow. For me, I just kind of want to feel how the muscle is reacting from underneath. And then as soon as I feel a little bit of like a twitch, I know that I'm on the right spot. And then I just trace all the muscle fibers. So we're going to go up and down, going into the shoulder. adjust. It helps people kind of decompress. Both feet out together.
Good idea.
You weren't kidding. You're definitely crunchy today.
Mm-hmm.
And let's see this side too. Let it fall. There we go.
A couple months ago.
Okay, so like 3-4 months ago?
Yeah.
And what were you doing?
Told my dad to crack my back.
Your dad cracked your back?
Yeah.
And that's when it started to hurt? How about lifting and bending?
Yeah.
A little bit, right? And then what about like sitting to standing, standing to sitting, getting in and out of a car?
No.
Nothing like that? Okay. And if I were to magically snap my fingers and you just got better today, what goals do you have for yourself you want to get back to doing? Like playing basketball more,
Yeah.
jumping higher? Okay, so you want to improve b-ball. Right ear to right shoulder,
No.
left ear to left shoulder. Good. Pain when I do this?
No.
Good. Any pain when I lift the head up like this?
No.
Good. Any pain when I press your head down?
A little.
Where do you feel, like over here?
Yeah.
Okay. Is it a stretch more or is it a pain?
Stretch.
I'm gonna try to press down, try to keep it up, okay? Very good. Flex it down. Do you work out at all? You sure you don't work out? You're strong.
A little bit like that.
Exactly. Hold your hands up like that, keep it nice and wide. And then really fast in and out. Okay. Why are you doing that?
I don't know.
I'm just kidding. You did great. So that's a test to make sure that your brain is working with everything else in the body. Good? Any pain with that?
No.
Which way?
No.
On both. Hey, that was easy. That's 21 by 14. I think you got the record for tiniest one. Don't move. Perfect. Good one. Now the next one. Okay, relax. Okay, gotta move you over just a little bit. Blow it all the way out. Keep going, keep going. Stop breathing. Don't move. I'm not terribly worried about her because she's young. She can bounce back very quickly. But the more that she doesn't address this now at her age, when she's your age, it's gonna be worse. And then when it's her father's age, it's very hard to come back from that. There's the foam roller one that I tell people about, and then there's the face down one. Depending on what you prefer going forward, we can do either or. Today we use the foam roller just so you can see what that's about. When you're pregnant and you have a big stomach or you have a big chest, people prefer the foam roller because it's more comfortable. Not that you're any of those, but I'm just saying for the future. So you see how off it is just by a little bit? That little bit right here is gonna dictate how her low back is doing. So, okay, just relax here. Drop, drop.
Oh, that felt
Whoa.
so good.
That was actually very loud.
Yeah.
Did you hear that?
So good.
Whew. That's it, done. Interlace your hands like this behind your neck. Now stay like tucked forward. Good. Big deep breath in. And blow it out. A little more. That's it. Relax his shoulder. Ooh. So what I've noticed with spines that are obviously younger, sometimes the pops are more muffled. Her low back was really, really bad, but the neck was kind of tame. We still got some pops there, which was really, really good. Turn your head left and right, see how that feels.
Yeah, it feels way better.
More free, right?
Yeah.
Send these, like a disruption to the area of complaint,
Okay.
which then elicits an increase of blood flow. And that increase of blood flow will allow your stem cells from within to help heal the body naturally. 3, 2, 1. How's that?
That's fine.
Not terrible, right?
No, not at all.
So about a 6 over here?
Ow.
Okay,
Sorry.
we got it.
Ouch, yeah.
Good.
I mean, really like walking in. Oh my god, it's good. I mean, it's sort of there, but it's so much duller.
Good.
Like,
Good. Excellent.
so much duller.
So this typically is done only once a week.
It's lower back.
Lower back?
Yeah.
Okay, so we'll focus on that.
Yeah.
On the low back in particular.
Oh shit.
You gotta let it fall. There you go. Beautiful. You okay? We're gonna give it a quick thrust upwards, okay?
favorite side?